Hello, Dr. Pat Ricalde again today, checking in with everybody from my house. And thank you for all the feedback. I was hoping today to do an update since the live video a few days ago, which received tremendous feedback, and I certainly appreciate that. I'm hoping to answer any questions that anyone may have, so feel free to use the buttons on the bottom to type me some questions, and I'll try to answer them as best as I can. So I think that since the last post, not a tremendous amount has changed. We are still looking at this COVID virus being a incredibly contagious one. As you know, the social distancing mandate is still present, and I completely agree with it. I don't think we can take this too seriously. Right now, I'm a little concerned about the lack of assertiveness that people are having when people sort of break the rules, and I wanted to talk about that for a little bit. If you need to go out to get your mail, go to the pharmacy, whatever, you need to be out in a place where you may come across other people, and somebody breaks your barrier, somebody gets too close. How are you handling that? I think that it's okay to say, hey guys, can you please back up a little bit? And sometimes people are uncomfortable doing that. I think that if you're kind, if you are calm, people are very understanding. I don't think that you should confront people. There's people that just don't take this seriously, and they have bad attitudes about it. And just like anything else in life, if you act aggressive, those people may escalate the situation. So I think it's best to just calmly and assertively state, please stand back. I do think at this point we are far enough into it that everyone who is out in public should have some kind of distance covering. When I go out, if I have to go out, I wear either a bandana or just a cloth mask, just in case. I feel like, let me use the analogy, if you're driving in a car and the car ahead of you's windshield spritzer goes off and your windows are down, and sometimes you can feel the windshield fluid from the car ahead of you enter your windows and kind of splash you a little bit. Well, what if the guy in that car ahead of you sneezed? It's the same concept, right? And so I'm just not in a position to want to take those types of chances. So protect yourselves. If you have to go to a doctor's appointment, I think right now doctors are all being very, very vigilant, but they don't have enough personal protective equipment to be able to be as vigilant as we normally are. There's requirements. The Occupational Safe and Hazard Association, they have very strict requirements about how we dress, when we wear masks, when we wear goggles, when we wear gloves. But everybody is sort of breaking the rules and changing the rules right now because this is a situation that we've never really seen before. So if you need to go and get your hypertension medicine, or you need to get your diabetes checked, or whatever the case may be, please just protect yourself. Wear a mask or a bandana or a scarf or whatever. Go in. A lot of doctors are kind of doing drive-through business, if you will. They'll let you sit in the parking lot. They'll come out to the parking lot and they'll give you your medicine, or they'll check on you or the whatnot, and that way you don't even have to go in the office. For those of us that need to go into an office, like at my office, we are trying to maintain 6 feet distance between patients. So we're trying to get just one person in at a time. And as that person is being seen, the next patient comes in, and we're trying to keep the flow in a circular fashion so people don't accidentally bump into each other. Don't bring family members, children, friends and whatnot to your doctor's appointments with you. Just the person who needs to be at the visit, go to that visit alone, go in, do what you need to do, and get out, okay? Because like I said, those are all situations where you could potentially be exposing yourself and your loved ones. Remember that the first doctor who reported the COVID was an ophthalmologist, and he found and reported this based on what he saw within his own population. He wasn't working at the hospital. He wasn't taking care of COVID patients. He actually got COVID from his glaucoma patient. It was just a routine visit, and he ended up succumbing to his disease, which was just so sad, and left a pregnant wife, I believe, behind. And so we just can't be too careful. So think about that. We are still going to have situations where no matter what we do, we're going to have to, do things. Hopefully everybody's taking this seriously and just staying home. My recommendation is anyone over the age of 65, they shouldn't leave the house. They really need to be home and protected. It doesn't mean young people are not at risk. The young people are still at risk. Remember the statistics. 40% of hospitalized patients as of March 13 or March 14 when the data came out, 40% of hospitalized patients are between the age of 20 and 55, okay? And that group compromised almost 1/4 of the ICU admissions, okay? So just because the age or health status, it doesn't mean you're immune. Nobody's immune to this, okay? Nobody has immunity to this. So be careful across the board. But yes, the older population is more at risk. So just keep them at home. The way that our family has sort of done that is, my elderly in-laws are in the home, not allowed out. They are completely 100% quarantined. If someone needs to go get a medication or needs to go out to get something and be in public, we have one person that we're sort of the sacrificial lamb, if you will, and that's my husband, the expendable one. And he's the one that we've designated the person that's going to go out and take the risk for the whole family. And he goes out, picks up whatever he needs to pick up, comes home and delivers it to the 3 or 4 families that we're sort of kind of looking out for. And that way there's only one person that has the risk of exposure. And as soon as he comes back in the house, before he enters the house, he gets everything he has in his hands. All of his packages are sprayed down, washed, cleaned. He immediately goes in, showers, because the virus can be held on to your clothes, to your eyebrows, to your eyelashes. So he always wears big sunglasses, mask when he goes out, and everything he touches, he decontaminates with hand sanitizer or washes his hands. And then as soon as he comes in, showers, cleans up, clothes get washed, everything, then he's allowed to interact with the rest of the family. To, again, just try to minimize your risks and to try to minimize your risk to other people, right? So we just have to be careful. You should still try to maintain some form of mental exercise and physical health. You should have a routine that you embark upon so that you're getting some exercise every day. It's so hard when you're socially isolated. We're a social group. You want to communicate with other people. But I see some dangerous activities. I see some of my neighbors where they're still walking dogs together and they're just standing too close. I see people sitting on each other's front lawns, standing a couple of feet apart, but just not taking it seriously enough. Please separate yourselves, distance yourselves. As hard as it is, it's just so important. The numbers are just stifling. We're looking here in Florida rising at about 30% a day in terms of our numbers, and our mortality rate, we haven't hit 14 days yet, but we are well above the 2% that is being quoted from Wuhan. And remember what we talked about last time, the mortality rates, you don't know what they are until people are dead, and you don't know what they are until the virus has been established for a while. So we really just need to be careful. I'm not asking you to be panicked or paranoid, but I do want you to take it seriously and really push people to just stay home and isolate as best as you can, okay? Online services are still going. We actually found a really fun way to get some fresh food delivered. We ordered some pizza and asked them to deliver it half cooked. So remember, the virus, if you put your food in the oven and cook it, you've killed off the virus. So if somebody happened to sneeze on my pizza, it was only half cooked. When I got it, I took it, put it right in the oven, and cooked it the rest of the way. Done. And then we were able to eat and enjoy some pizza. So the pizza places are still open. We're still primarily cooking all of our own food, but that's something that is an option for some. So let me see if I can take some of these questions.
Can I add something for a
Oh,
second?
sure. Sorry.
No, one thing I've come across is that people make assumptions that the people working in restaurants or working in certain industries that have to stay open are using the proper safety guidelines in preparing your food or in moving things about. To that I say, human nature, okay? That's not going to happen. It's not even happening in my own family. I mean, we have a hard time not breaking our own rules that we're putting, and we've put a lot of thought into this. Another thing to consider is any activity that could land you in the hospital or in a medical office. Things that you normally do, I do a lot of them where I get hurt. I have to think about whether or not I want to put myself in a situation to get injured and then wind up in a hospital for another purpose.
Yeah, good point. Maybe it's not the best time to trim your palm trees or, do things that could theoretically get you, laceration or get you, fall or break an arm or something. This is not the time to be in a hospital for an elective reason and potentially expose yourself. Okay, so questions. Dr. Ricalde, I know there's a lot of misinformation out there. What is your take on the time frame about possibly resuming procedures, dental surgery, etc.? Unfortunately, I am very pessimistic about anything happening in the next 3 months. Look, China, they were able, after 3 months, to begin reintegration, socialization again. How were they able to get that? So their numbers were going up, 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 up. And then finally, they started to plateau, and they weren't on the downside for 3 months. And so what allowed them to make that turn? Because the Wuhan province is only one section of China. China's a huge place, right? With a lot more people than just those that were affected. So how were they able to actually get that plateau and get down on the other side? Well, let me tell you, it's because when they saw their numbers going up, 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 and they weren't able to control them, they put into place severe fragmenting of cases. And what do I mean by that? They divided their population into those who were sick with the disease, positive but not sick with the disease, super at risk because they had interaction with someone who was positive, and then known negatives. So they took those 4 categories and they separated them. So they took people out of their homes and put them in temporary housing units. Hospitals divided up. They had hospitals that just treated COVID patients, so they weren't mixing sick with negative COVID patients. And once they really got strict with breaking the population apart so that there was severe fragmentation from people interacting with each other, that's how they were able to get things to plateau and then finally to decrease their numbers. So I don't know about you, but I don't want anybody coming into my house, force testing me and taking me to a temporary housing facility, but I do want this to end quickly. And so I think that if you look at that curve, that was a 3-month phase. And so people giving claims like, oh, we'll be back to normal in a couple of weeks, I don't know where that's coming from, but everything I've read, everything I've seen, I think that we are realistically looking at a minimum of 3 months. So I'm trying to brace myself to consider 3 months being out of work in terms of elective procedures. Let's see what else. So in terms of outpatients,
Can you
excuse me 1 second.
Can you address that question?
Blood test.
It's from
Yes. Okay.
Alright.
So there's a question. Have you heard anything about blood tests to see if one had it to see if they have an antibody. Yeah, so testing is available now. They have, and the testing is in two parts. When you get a test, it'll tell you, are you actively affected with the COVID, or did you happen to have it and your body developed an immune response to it and now you don't have it anymore? The test can actually discern that. The problem is it's still difficult in terms of the volume of people who are worried about COVID and the number of tests they can actually perform. I don't know what the exact numbers are, but each institution can probably only do 100 or 200 tests a day. I heard that there was a group of labs that said they could do 1,000 tests a day. You know, in the grand scheme of our population, these are still tiny numbers of people that can be tested, so they are still trying to direct more high-risk patients for testing, but you can get testing. In fact, there's several drive-through testing sites up now. And you can work through, in fact, if you go to the Department of Health in your county and you look, they have 24-hour COVID lines now, and you can look and see where in your county the drive-through sites are. Now, most of these, you can't just drive in. You have to be referred by a physician in order to get the test. So you still need a referral or a prescription. So the best thing to do is call your physician or call the county health department and tell them why you have concerns, and they will typically over the phone arrange the referral so that you can go and get your drive-through test. Yeah, great question. I work in an outpatient surgery center and also in surgery at a hospital. Both places were doing all kinds of surgery right up until last Friday. I'm concerned about not having supplies needed, example masks, to do surgeries or procedures even once the restriction is lifted. You know, that's a very good question and a very important concern. Look, hospitals, clinics, nobody has enough PPE right now. There is a severe national shortage of PPE. What do I mean by PPE? That's personal protective equipment. In other words, the gloves, the masks, the hats, the goggles, everything that you have. So right now, 100% of available PPE has got to go to healthcare providers. Please, if you are hoarding supplies, take and donate them to healthcare providers. Your primary care physicians, your pediatricians, your hospitals, your urgent care clinics, I can promise you they are all in short supply. So I understand there was a big arrest in, I think it was Oregon or Washington. Someone was found with thousands of N95 masks, and they were arrested. And good for the police to find them and arrest that person who was becoming an opportunist and taking advantage at a time when we need to all band together. I'm so angry about that, but I'm glad that they found them, and kudos to our law enforcement for finding them. But yeah, that is a concern. Unfortunately, we don't have an answer right now. I was able online to find a company that had some N95s, and I ordered 1,000 masks last night, but I don't know if I'm ever going to get them. I don't know if it was a sham. I have no idea. They claim that I'm going to have them in 2 to 3 weeks, and I'm hoping that I'll be able to, once I receive the supplies, start disseminating to people I know who need them. Another question. I feel that the whole country should follow the same standards, including but not limited to surgery, procedures, beach park closings, etc. You know, Erica, you're absolutely right. To me, it's crazy to think that there is a state in our nation that is not on lockdown. We should all be uniform at this point. I mean, come on. It's a joke to think that West Virginia, for example, as of a few days ago, claimed they didn't have any cases. They didn't have cases because they weren't testing. Of course they have cases. It's everywhere. Remember, if today you have 100 cases, you know, those 100 people have had that disease for an average of 5 days. Some of them have had it for up to 2 weeks. So it's ridiculous to think that those cases aren't out there. Those people are walking around. 87% of positive people are asymptomatic. They don't know they have it. They're walking around and feeling fine. and they're shedding virus. And so we are all going to suffer from that. So we have to lock everything down. And I agree, everyone should follow the same standards. I also think that every single healthcare provider, I don't care if you're the triage person at the front door, if you're the security guard, if you're the nurse, the physician, or anything in between, the radiology tech, they should all be 100% PPE. And I feel very strongly about that. We need to protect our healthcare workers. Look, as of last week, almost 25% of positive cases in Philadelphia were healthcare workers. Healthcare workers are getting sick. It is not okay. And I'm concerned that, hospitals are doing what they can to try to ration out the equipment they have. But some hospitals, I've heard from people on the front lines, are actually telling their staff, don't wear the N95, you're going to cause panic. No. This is not, stop. We are not panicking. We are being logical and we are being rational. We have to protect ourselves. Healthcare providers have to work together and they have to be protected. We need PPE. So hopefully, I know the government is doing a lot to try to get companies to transition. Instead of making car parts or whatever, they're making masks. So I do think over the next couple of weeks, we're going to see a huge amount of PPE coming our way. But every day that goes by without it, I worry for my friends.
Pat, that question that came in, that was specifically about a blood test, meaning somebody had it, they no longer have it. Is there a blood test available to see if that person then could have antibodies that could be used towards the solution or the cure?
I don't know about that. I can do some research and find out, though. Okay. Some more comments. I'm concerned about a boomerang effect given the long incubation period with the strain, which mirrors the Spanish flu a bit. So I share your pessimistic approach, unfortunately. Well, Jeff, I really, I'm trying not to sound pessimistic. I'm trying to sound stern. I'm actually very optimistic that we're going to get through this. I think that we actually are doing a great job. If you look at the exponential rate of growth, we're actually doing a really good job at flattening our curve and allowing this to come at us in such a way that hopefully we're going to be able to handle the influx of patients. Having said that, we have a long way to go. So even though we are making progress in containing it and trying to keep our curve down, we are in this for the long haul. There's a lot more that's going to come our way, and I do think things are going to get worse before they get better. Vaccination development and approval. What level of understanding do you have? So here's my 2 cents on vaccination. First of all, look, it takes a very long time to get vaccines, to develop a vaccine, and then of course to test it in such a way that it can be proven in a vigorous fashion to be safe, okay? And I've been, arguing with the anti-vax population or anti-vax people for a very long time because I feel so strongly that vaccines are safe. Now is not the time to break our protocols and rush things, even though it is incredibly important to develop a vaccine against this disease. We can't cut corners and potentially put a vaccine out there that's not totally safe. And listen, this is why I'm concerned. Vaccines are meant to be taken and injected into a totally healthy person, right? It's not like someone who has high blood pressure and you're giving them a blood pressure medicine. Well, they already had a problem to begin with. So you're willing to accept some risks in that blood pressure medicine. Okay, it'll make your blood pressure feel, better, but maybe it'll make you a little bit dizzy. So maybe you're willing to take a little bit of risk with that benefit. When it comes to vaccines, there was nothing wrong with that person to start with, right? So if you give them something and you potentially make them worse, that is devastating because you don't know if they were ever going to catch that disease to begin with, right? So that's where we start with the whole vaccine conversation. So with vaccine development, the FDA has a very rigorous process, and it should be maintained. Look, the average vaccine takes, I think I read, 20 to 30 years to develop. A lot of people misunderstood Ebola. They're like, well, how come when Ebola came out, they had a vaccine, like within, I don't know, a couple years or within a year? Yeah, well, that vaccine was actually, they had been working on Ebola for 20 some years before that event became a catastrophe like it did. They already had that well under works. So they were able to switch into that last phase of testing and get that vaccine out and rolled out pretty quickly. We've never seen this strain of coronavirus before. This is brand new. Can you shut that? This is brand new, so they're starting from scratch. So to take this and try to roll it out within a year, I think is fantastic, but it does make me skeptical and it does make me concerned. So I think that I am going to hold my thoughts on what's going to happen with this phase that they're testing currently in Washington. I really hope that it works out, but I'm not sure that it's going to be done quickly. Certainly not within a year. That's my opinion on it. Those are all the questions I have so far. Did you want me to cover anything else?
No, just one thing I was thinking. The one person mentioned that he shared your.
Oops.
That's
Sorry.
not good.
Sorry.
He shared your pessimistic view of this, and folks, I think it's important that you don't looking at the worst case scenario is what the world needs to be doing in any situation. Not stop living, not stop enjoying life, but preparing for worst case and hoping for best case. This is a lot like any type of security operation or planning a security operation or planning a search warrant or anything like that. You think of everything you could possibly think of so that the outcome in the end will be the best it could possibly be. It's similar to rings of security, okay? You're in the middle and you have rings around you, and each of those rings is a security measure. It's the same thing with protecting yourself from this virus. Anywhere that you make a mistake in those rings is a vulnerability. So if you're going to a grocery store and not wearing a mask, that's a vulnerability. That's something you can do to make your chances better of not contracting the virus to begin with. And then if you do contract the virus, then there's a bunch of other things that you need to consider and what you're going to do and how you're going to deal with that if you do.
Okay. So, I think the key points that I wanted to bring up today is that we're still in the thick of it. I think there has been some false information regarding the length of time that we're going to be doing this. I keep hearing people saying, 2 or 3 weeks. I do think that that's probably a severe underestimation of where we are. I think that we are probably looking at 3 months. And so everybody just be prepared, think it through, try to plan for that. Look, if I'm wrong, I'll be the first person to just, start hugging everybody and re-socializing right away. But I'm preparing for the 3 month. I'm trying to look at it in the long term. So I think that's just a really important message I wanted to get through today. I also wanted to say that it's really important not only just to plan for your food and your preparations, but for your mental health. Please try to plan exercise programs. Please try to think of, intellectual stimulation. Think about ways to keep yourself fresh and energized and optimistic. If you're a spiritual person, with prayer, if you meditate, keep those things and stay grounded and stay focused, because this is definitely something that we will all get through. We just need to write it out together. I'm happy to take questions. I'm happy if you guys want to PM me or text me or email me or whatever. And I will try to gather some more information, get back on some of those questions I didn't know the answers to today. And I'll try to do another live Facebook maybe by the end of the week. All right. Thanks, everyone. Stay safe.